So we are Nandini Sinha, Shreya Nivasan, and Avnish Jadhav from Chatham High School. Here with Dr. Sharma, talking to him about cystic fibrosis. Dr. Sharma, would you like to introduce yourself to us?
Sure. My name is Ram Sharma, and I am an internal medicine doctor. I teach in medical school. I am a doctor for donkey's years, as you can see. At this job in America, I am in 25 years yesterday. And I teach in Geisinger Medical School and teach the residents who train in internal medicine. You know what internal medicine is, of course. So this cystic fibrosis falls in my domain. Obviously, lung doctors look into that too, and depending on other problems, many other practitioners are involved treating cystic fibrosis.
The question. So my first question for you was, can a lung transplant cure cystic fibrosis?
Lung transplant is one of the treatment if the disease is confined to the lung only, because this disease can affect many organs. So if lung and pancreas and bowel and other organs involved, then it will be tough to just do a lung transplant and treat it. But yes, at times, given the selected number of people with this disease, can be quote unquote cured by lung transplant. That is true.
What medications do people with cystic fibrosis take? And then what are the side effects that they might have?
Okay, so again, first the diagnosis is made and then assessment is done as to how many organs are involved. As I just told you, this can involve lungs, pancreas, bowel, liver, venous circulation, and it can cause electrolyte balance. So treatment, there is no cure as such, but the disease can be stabilized and can be kept in check by symptomatic treatment. So whatever the lung symptoms are, those symptoms are treated. And so far, there isn't any medicine as to cure the disease. Okay. Immunotherapy can work to arrest the disease in some ways, but again, that's not the cure. So treatment is primarily based on the symptoms of the disease, and symptoms is looked into in various organs by test and x-rays and clinical condition otherwise.
And following up on that, I was wondering, what age range is it most at risk for this condition? Is it typically children or older people?
Okay, the short answer is everybody. So there is a mandatory requirement to screen children when they are born, babies when they are born, whether they are prone to have cystic fibrosis. There are some tests which is done, and the tests are of two types. One is lab test, like testing chloride level in the sweat, from the sweat glands, and genetic testing, because it's a genetic disease, autosomal recessive disease. And with full penetration of the gene, the disease manifests full-blown and affects many organs, sometimes with not so full penetration of the genes, alleles as we call, then disease can be limited. But the babies, within 2 weeks after they are born, a test is done, and if there is suspicion, then the genetic testing is done. And that's how it is diagnosed. And then they are watched as they grow and symptoms treated. So, when the babies are born, one of the presentation is known as meconium ileus or ileus. Meconium is that substance when baby is born, comes to their gut, which they expel. Normal baby expels that, but people or the babies who are prone to this disease will get intestinal obstruction with that. Remember, this disease causes thickness of all kinds of secretions in the body. That's what the causative problem is, of lung symptoms or bowel symptoms or biliary symptoms. All the secretions get thickened, and that's how it produces symptoms. So babies are tested, and if they are negative at that time, doesn't mean when they grow up, they won't show the symptoms of cystic fibrosis. As an adult, you can start having the symptoms, and then with that, then the diagnostic workup is taken up and the diagnosis is made. So it can present in babies right away, one can know, and genetic testing is done. It can present when a person is growing in adolescent age or even as an adult. And main symptoms in babies are obstruction of the bowel due to the thick meconium, and respiratory symptoms, breathing issues, bronchitis type symptoms, and so on. And in babies, failure to thrive. Baby doesn't thrive well. And that can be an indication to take up the test and make sure the baby doesn't have cystic fibrosis. When adults get this disease or manifest when they are adults, again, nutrition becomes one of the problem for these people. And again, it depends how many organs are affected. Mainly affects the respiratory system, the lungs, but the bowel, liver, sinuses, nasopharyngeal tissues, they're all affected because of the thickness of the secretions all over the body, in all parts, in all organs. These people are not fertile. They can't have babies because there is no secretion or no fluid for the sperm to travel. So if you are a male, you can't impregnate a woman, can't have a baby. There is nothing wrong with the sperm, but the sperm can't move, and that's the issue. A female can have baby, but they can have difficulties about that too. But that's not taken for granted. But 95% of males have no fertility. They are infertile.
Okay, so one of my other questions was what could happen if a person with cystic fibrosis would like interact with another person with cystic fibrosis?
Yeah, it's not an infective disease. It's a genetic disease and electrolyte imbalance problem. So it's not an infective disease. However, because of the weak lungs and symptoms with bronchitis, and there is no surfactant on the alveoli, the lungs, So they are very prone to get infection. So that's the secondary infection one can get, and all kinds of bacteria and viruses are involved in that infection. So if an infective agent uh, um, um, is affecting the person, then that can become infective. But cystic fibrosis per se will not give anybody infection. A cystic fibrosis person near you or in your contact will not give you cystic fibrosis. But if his lung is affected or has bacterial problem in the lungs, very resistant bacteria, then that bacteria from that person with cystic fibrosis can infect you. And a person can be sick with that. It's like viral illnesses. A viral illness can be infective to other person. So cystic fibrosis people are more prone to have these infections in the lungs, and that infections can be infective to others. But cystic fibrosis per se uh, is not going to be acquired by other person who is near you or in contact with you. Okay.
What is usually the life expectancy for someone with cystic fibrosis?
Okay, so in Esther years previously, many years ago, these people didn't live long because of the infection and organ failure, depending on how many organs are infected, primarily, more commonly, lungs and pancreas. And they can have clots in the veins and all that. So they used to die in their late 20s, early 30s. But nowadays, because the symptomatic treatment is good, infections can be treated by IV antibiotics and all that. There are other respiratory treatments which can be given to improve their overall condition of the lung. Nutrition is provided better these days. So with those things, a person is living longer. So now they live in their 50s even. Normal expectancy of life is not that common, but they are nowadays, with advances in medicine and treatment of secondary infection, bacterial and otherwise, they are living longer.
I was also wondering, are you familiar with any of the new technologies nowadays that they use to diagnose this illness?
Yeah, so far, there isn't much new technology, but the same basic problems are diagnosed much more easily these days. So doing genetic testing has become much more easy now, recognizing the chromosomes and finding out the mutation gene and doing the test on your sweat, estimating the chloride level in your sweat. That test has become easier. So if the sweat chloride level is more than 60 millimole per liter, then that's kind of pretty diagnostic and indicative of cystic fibrosis. These tests has been known before, but with advances in medicine, to do these tests is much more easier these days. In summary, this is a kind of genetic disease, autosomal recessive, we call it. And that's one of the tests done to diagnose it. And very indicative is the chloride level testing in the sweat. And when the baby is born, that time doing this test of chloride in the sweat is difficult. But after 2-3 weeks of life, this can be done easily. The other point to mention is that primarily this disease thickens all kinds of secretions in the body. And that's what causes the problem, obstruction in the bronchial tubes. And that's what causes lungs to collapse. That's what causes bronchitic problem and sickness. Your sinuses can be completely clogged and completely wiped out and so on. So that's prompt symptoms. Pancreatic juices are completely thickened, and pancreas secretes a juice in the bowel for digestion. And if that's not there or insufficient amount, then digestion problem, bowel problem. It can cause kidney stones. It can cause biliary duct obstruction again, so liver problem, thrombosis in the veins, clotting, which we call. Same way, sperm sperm motility is affected, so the person becomes sterile, person cannot have babies for that reason. There is another not so common symptoms, but pretty indicative of this disease is that somebody puts their hands palm in water for few minutes, 10-15 minutes, they get wrinkling in their palms, nodules forms. They can get redness of the palm and all. It's called aquatic wrinkling. So all these symptoms, and electrolyte balance in the body, in the blood, person can get anemic for this. So all these symptoms, it's a very, very difficult disease to treat, and it's a spectrum of symptoms. Not everybody gets everything, but predominantly lung problem, pancreatic problem, and in the babies, obstruction of the bowel due to meconium and so on is more seen than other symptoms, but anything can happen to anybody who has cystic fibrosis. And again, usual cause of demise or death or significant morbidity is due to lung symptoms, because the alveoli, which on the surface has a surfactant, a liquidy type layer, and that's completely thickened, and lungs cannot expand, and breathing becomes a problem, and that causes infection with bacteria, pneumonia, a special organism, a special bacteria called Pseudomonas, and that infection is very serious. So that becomes usually the cause of death, lung problem in these people. So wide spectrum of manifestations, symptoms, and this is not that uncommon a disease actually. If you are a white Caucasian person, 1 in 3,000, 4,000 people get it. If you are Hispanic, 1 in 10,000 people. If you are Black, 1 in 15,000. If you are Asian American, 1 in 25,000 or so. That kind of statistics has been forwarded. So it's not that uncommon, but it's happens due to the DNA mutation, gene mutation, and on chromosome 7. And that's what is measured. And as I said, chloride level measuring in the sweat. These are the two major diagnostic tests.
Okay, thank you so much for being here with us and helping us out.
Oh, no problem. You are welcome.
All right, thank you.